taxes on packaged essentials like flour, pulses, cereals, curd, milk, etc. will pinch your pocket. Yes, it will, no doubt. But the big story, the huge hit that needs to be highlighted is the application of GST on even hospital beds. For the first time, hospital beds of more than 5,000 rupees a night will attract a 5% tax. This tax will not be getting the benefit of input tax credit. Simply put, no adjustment for costs borne by the hospital, essentially goes straight onto the patient's bill. 12% GST will also be levied on biomedical waste treatment and a cancer therapy evaluation program. That's 12%. Meanwhile, GST on health insurance remains at 18% instead of 5%. There was a proposal of 5% in front of the same council. They've turned it down. So the argument for this tax and the one on medical beds is rupees 5,000 is a fair cutoff. It's just for the rich. Let's take a look at the average starting rates of hospital beds in top metros. It starts from about 2,500 rupees and upwards. And these lower price beds are not always available. To assume it is the super rich who are booking hospital beds at 5,000 rupees and above is honestly closing your eyes to the reality of healthcare in this country today. 65% of expenditure on healthcare by Indians is out of pocket. That is one of the highest in the world. By out of pocket, I mean your insurance company doesn't pay for it, your government doesn't pay for it, you pay for it whether you can afford it or not. We know how big medical bills destroyed the finances of families. We've seen it right now during COVID-19. It's not an old story. The average expense for a rural household annually is 15,937 and 22,031 for urban Indians. Medical bills are believed to push 55 million Indians into poverty every year. Meanwhile, some can always say, so what? This is just on private hospitals. Why don't you go in for government hospitals? Well, the fact is, and this is the NSS, the National Sample Survey that I'm quoting, 61% of urban Indians depend on private healthcare. 52% of rural Indians depend on private healthcare. So how much is the government actually spending on healthcare? We spend just about 2% of our GDP every year on healthcare. So the situation is that if you are sick in this country, you have to depend on a private healthcare provider, their terms, conditions, their prices, their costs, and now you need to pay a tax. Is this tax justified? Is the question we're asking today. I'm speaking with Dr J.A. Jayalal, former National President of the Indian Medical Association. I have with me Rajat Sethi, author and economist on the show. And I'm also speaking with Dr. Subhash Salunke, Senior Advisor, Public Health Foundation of India and National Member of the COVID-19 Task Force. Welcome to all of you and thank you so much for speaking with us this evening on Beyond the Headline. Dr. Jayalal, I want to start by asking you about the letter that your organization has sent on this issue over the last couple of days, where you say this is profiteering. You equate this tax to the salt tax that the British used to levy. Why such harsh words?
Yeah, it is quite unfortunate that so far with the wisdom, none of the finance ministers dare to touch the hospital where the lot of poor people and the rich people are getting treatment, taxing it. But all of a sudden, suddenly today, as new announcement has come, it is being implemented for all the patients who are coming to the hospital who are going to stay in a semi-deluxe rooms where they are going to charge more than 5,000. It has to be taxed. When this is a great burden for the hospital, and when the patient is coming to the hospital, it is not only the room tax, he has to undergo a lot of infrastructure fees, the consultation fees, medicine fees. And now a patient has to be given 3-4 different kinds of bills where one bill is going to get a 5%, another the biomedical waste is going to have the 12%, and this is going to result in a great jeopardization in the hospital. Not only that, and it is not the hospital per se, because of the GST is not applicable, we do not have the input tax crediting. So that means this amount, this entirely is going to be borne by the patient.
Now, 1 minute, I want to understand something, Dr. Jayalal. On an average, and we pulled out some of the data of average hospital bed costs in metro cities, it starts from about 2,500. They could argue, and I know Mr. Sethi wants to make that argument, but I'll preempt it and allow him to come back into the details. They could argue that there are cheaper options. Why do you have to take a 5,000 rupee bed if you don't want to pay 5% GST? I want to understand whether there really is such a plethora of choice for patients when they come to the hospitals. I mean, during COVID-19, you would be lucky if you got any bed and you'd pay whatever you could for it to survive. So is there really such a wide choice or alternatives or options which are available?
Yes, it is indeed, it is necessary also, because the people who come with the disabilities, people who come in the antenatal where they are not going to have the single room, they are going to have a delivery, there the baby suit has to be there. So people who are used up to that infrastructure, now even with the normal room rent in any hotels is going to cost you around 4,000 to 5,000 rupees. And that way, patient is going to the hospital with an additional infrastructure, and extra care has to be given, a semi-ICU setup has to be given, where the charges are going to be definitely high on their part. It is not only that, the major problem comes Ayushman Bharat. When the government of India wants, majority of the people should come into the Ayushman Bharat, where they have a package system, have entire cesarean section or entire hysterectomy, you have a 30,000 rupees. And now if we are going to say that in what kind of rooms and what kind of setup that these people can be put into that. And all these are we are giving with the package system of giving. So when there is a package system is given, and how the room rent is going to be charged. So this is either you must be putting the tax GST for the entire hospital service where the common bill can be given and the credit tax will be also given to the hospital. Otherwise, putting one by one, adding on to the bills as a 5%, 12%, it is going to become a great problem in administration also, and also for the people who are going to come. Suppose, for example, you take when the patient is coming here, the lower cadre beds are not available. A poor man coming and he has to be accommodated in a room available. Just because the rooms are costing 5,000, he's not going to get the best treatment available in the hospitals. And you have very well rightly said, the responsibility of the health, giving health to the people is the government responsibility. Since the government is not...
My question also is with this poor and rich kind of thing. I can understand if you're doing it on luxury items. I can understand you want to tax someone who wants to drive an expensive car, or, you know, who wants to indulge in something which is a luxury item. Should healthcare be treated like that is the essential policy issue. Dr. Subhash Salunke, I'd like you to come in on this.
I'm really surprised and also unhappy the way government of India and also the state governments have taken such a decision. Look at the health system of our country. If you look at the various states, you find our entire health system of this country, including preventive and also curative part, is far from satisfactory. So where will people access the health care, particularly the hospitalization part? From your statistics, which is being presented right now, 65% of the people necessarily go to the private sector for hospitalization. Obviously, governments in the past and also in the present have not been able to, in spite of so many schemes and so much of boasting being done, rhetorics are being presented that we are taking care of poor, middle class, higher middle class. It's not happening. The COVID has brought out very clearly the shortcomings of our healthcare delivery system in public sector as well as in the private sector. We have to appreciate that there are people who are not in position to spend so much of money, but they certainly look for a quality of healthcare. I know I have gone to various states of this country. I know what is happening right in Delhi and also in the northern India and South India. So what kind of an healthcare...
Dr. Salunke, I want to understand, because, you know, you've been part of the COVID-19 Task Force, and that the pandemic actually blew the lid of our healthcare system. I want to understand that when people were scrambling for beds, were they able to look at this 5,000 rupee above, below kind of a parameter or a category?
People, even in spite of their, you know, they were ready to spend lifetime savings because they wanted their relatives or themselves to be saved. That was the reality. And in that particular pandemic situation, there was absolutely no question of 5,000 10th. I know people have spent their life saving for getting proper treatment and also getting even beds in the private hospital because they were not available in the public sector hospital. When people were lower middle class people were ready to spend whatever they can because they wanted their relatives to be saved. So that's the ground reality. Now, I appreciate that government requires money, but is this the area where they want to tax? What is this? Why can't you think about people who are having billions of rupees, tax them more? Why can't you tax tobacco industry who are killing people? Why don't you tax alcohol industry?
Let me bring in Rajat Sethi. Let me bring in Rajat Sethi on this. Rajat Sethi, you've heard the arguments. We've seen the letter from the IMA, and I'm going to run some of the quotes from the letter from the Indian Medical Association. It's a very strong letter, and it talks about how you should not tax healthcare. Now, healthcare was exempt from GST before the 47th GST Council meeting. What do you think is the rationale for adding this tax, Rajat?
See, there are three primary reasons which have been researched by a group of ministers, which constituted the finance ministers of 3-4 states. Some of them belong to the opposition, some of them belong to the current ruling dispensation as well. And there was broad level of consensus which was arrived based on a lot of facts and a lot of research that GST Council has been performing. It reached to that common conclusion that there are certain formalization elements which have to be brought in into the hospitalization domain, which is possible if you go in with the minimal amount of taxation to the most affluent class of services that are available. Now, what has happened is the entire gamut of the health services which the public sector has to provide needs to be accounted for through additional sources of taxation as well. But what has happened is that because of COVID and all the other reasons, there have been deficits on tax collection, etc. The health sector so far has not. I can't even hear myself. The voice is so.
We can hear you fine, Rajat. We can hear you absolutely fine.
My voice, I can hear my voice. Sorry. So, see, essentially, what has been thought through is that the upper strata of the rooms that have been there that are above 5,000 rupees will incur a minimal amount of 250 rupees as taxation, which by any metrics and by larger rationale does not hit the bottom line of anybody who's availing that service. Now, input tax credit, an individual patient goes in, avails that.
In about 30 seconds, and I'm still trying to understand your point. Are you trying to say it doesn't matter because those who can afford 5,000 rupees a night can afford the 5%? Is that basically your argument, sir?
See, that's number one. But formalization of this sector, there has been a lot of evasion of taxes in the past, which has been documented pretty well.
Formalization of this sector? I mean, this is private hospitals. How can patients evade taxes?
You can't have certain darling sectors out there which you do not tax.
Darling sectors? Rajat, tell me something. Who does 1 minute, 12% GST on cancer therapy. 1 minute. Cancer therapy evaluation program will now attract 12% of GST. Are you saying that patients who need this deserve to be taxed?
You see, there are ample number of line items which are still not taxed. Do you want to cherry pick a few of them? There would be some reason or the other which the tax authorities have gone through in detail. Why did they specifically choose this? Did you try to do that research?
Okay.
My point is that you are trying to tax a very, very important and an upper strata of the society so that you can service the poor more effectively. If you are not having additional sources of revenue, how do you sustain schemes? And by the way, Jan Aushadhi scheme, or you have this blanket insurance scheme where the limit from 5 lakh rupees is going to be stretched up to 7.5 lakh rupees. All of this requires, in an ideal scenario, let us not have taxations at all.
Okay, so 1 minute. Let me just recap all of your arguments. One is that if you can afford 5,000 rupees, you deserve to be taxed. Second argument is, kiya hoga to kuch sahi socha hoga, because you're saying that they looked into it. And then you're saying that this 5,000 rupees per night, 5% bed needs to be taxed to actually subsidize the poor. Tell me something, Rajat. What is the average GST collection in the last 7 months? You know, it's over 1,40,000 crore rupees for the last 7 months.
Do you know the
So clearly, GST collections is not the issue in itself. Wouldn't you agree with that?
Not at all, madam. What is the effective GST tax rate? And what was the effective GST tax rate which was envisaged at the time GST was being planned? It was 15.5% that was being envisaged. And today that effective neutral GST tax rate has been brought down to 11%.
I'm not talking about putting GST on packaged paneer. I'm talking about GST on healthcare. Rajat, you've not been able to give me a cogent argument why someone should be taxed for being sick.
Why would you or me going to a hospital, affording the premium deluxe rooms out there, not pay for the taxation? Please tell me that.
Okay, Jayalal, your response
why
to
would
that.
you, these doctors or myself,
you're rich, so what if you're sick? And 5,000 rupees means rich. 2 doctors, 2 very senior medical professionals have told you that's not the case. But anyway, yes, Dr. Jayalal.
No, madam.
1 minute, Dr. Jayalal is responding.
It is not only for the room rent. Biomedical waste management, now it is going to attract 12%. The cancer therapy evaluation is going to attract for 12%. And tomorrow, if you are allowing, and for the every small thing, just because you say that there is no GST collection, you will add unto that. If the patient comes with a fever, you put, if your patient is coming for a cesarean section, you put the tax. And this is something absolutely nonsense way of thinking. It is as equal to the salt tax which was introduced by the Britishers. That is why IMA is taking it very seriously and we are opposing it. Please, you have to come to one hospital, corporate hospital, and see, is it only the rich man is being affected there? The poor people
why don't you reduce the room rents accordingly? Pass on the benefits to the end user, reduce the room rents, bring it down from 5,000 to 4,750 rupees.
The hospital do not have a credit tax facility. We don't have a credit input for the GST.
You are not paying the tax, sir. It's the end user who's paying the tax. It's not the hospital owners who are paying the tax.
We are only worried about not worried about the doctor. We are only worried about the common man. That is why we are opposing.
Please reduce the rates. Why do you charge such exorbitant?
So one sec, Rajat, I want to understand this. So you're saying the next time government increases taxes, companies, instead of passing them on to the end consumer, should absorb it themselves? Is that what you're saying should be the standard response?
That we can go about. We can keep debating counterfactuals. Look at globally medical healthcare facilities and how the taxation systems are there.
Absolutely. I'm glad you spoke about that. Yes. The kind of country we are, the average incomes we have, look at how much we spend as a percentage of GDP on healthcare.
Please do that. And I'm telling you this thing as a matter of fact.
So my point is, and this is why I'm not saying that why tax 5% on, curd, lassi, paneer, atta, packaged, at least you have an option of unpackaged. When your family member is sick, when you're fighting for your life, you're going to take that bed, whether it's 5,000, 6,000, 10,000, whatever. Because you want to save yourself. Dr. Salunke, I want you to come in on this. You're acting as if there are tons of alternatives out there. My point is, if there were alternatives, it would be a different story. Dr. Salunke, one sec. Dr. Salunke.
Yeah, I think
1 minute.
Without taxing.
1 minute.
Let us try and...
We've paid COVID cess for how many years, Rajat? How many years we've paid COVID cess? 1 sec. Dr. Salunke.
Yeah, I think we have to appreciate that as a country, and this government, earlier governments have indicated that we should go for universalization of the healthcare. Now, universalization of the healthcare is an obligatory kind of an situation where, irrespective of the capacity to spend, and out-of-pocket expenses shouldn't result into the poverty line people being pushed below the poverty line. Now people are saying that if you can't pay 5,000 rupees or 4,999 rupees, you are going to afford. And if you pay 5,001 rupee, that means you become super rich. That is not a logical kind of an argument, number one. The moment we think about ensuring the positive care and positive health status of our countrymen, it is obligatory for the governments, state government or central government, to ensure either you improve your public sector hospitals in such a way that most of the people access the services there. Or
Thank you.
then you
Exactly,
exclusively
sir.
keep
For
it.
this, you need to
Just
tax.
please,
No,
Mr.
no.
Sethi, let me complete. Or when till that time that you are not in position to do it, private sector access is obligatory, must, it is needed. So under the circumstances, a lower middle class person or a higher middle class
I want to
person
pull up
who
that
wants,
data
No,
again.
please allow me this answer.
1 minute.
Today.
I will, Rajat. Hang on. I will. You will get all the time. Hang on. Rajat, you will get time. Calm down. Calm down. Calm down. You will get time. I want to pull up that data
Tamanna, 1 minute,
on the
1 minute.
amount
Just give me
Indians
a moment,
spend
please.
on private healthcare. One by one, gentlemen.
1
One by one. Rajat,
1 minute,
you will
can
have
I
to wait
complete?
your turn,
How many
Rajat.
proportion of beds are above 5,000 rupees?
Okay.
How many proportion of
minute.
Rajat, you will have to
private
wait
beds are
your
above
turn, or you will
5,000
have to be muted, sir. Please. Let's go one by one. It's only fair for our viewers. I want to pull up now. I want to pull up how much we spend, not out of pocket, but on private healthcare, our dependence on private healthcare. For urban Indians, it's over 60%, and it's over 50% for rural Indians. That means if you are sick, can you actually go to a government hospital? Will it be available for you? Well, unfortunately, that's not the case. That's not the case. The number of government facilities are fewer. Private healthcare has had a bigger role to play in our healthcare infrastructure. That is why, Rajat, that is why, and I'll give you complete time to make your point because it's important to have everyone's voice. That is why
I want
the
to make a
entire
point.
Ayushman scheme is based on bringing in private operators. They didn't want to be part of the scheme. They have to come in because they have the bulk of the beds.
So,
there could be alternatives.
can you tell me how many
available now.
proportions?
Please try to
So,
understand.
Please, I have one
So,
simple
if I have no
question.
choice and you want to tax me,
simple question.
Yeah.
I have just one question, and that is going to rest this debate. How many percentage of beds of all the private hospitals are charging above 5,000 as a proportion of total number of beds? Give me that percentage.
It is 35 to 40% of the beds.
No, sir, don't. This is a vacuous argument. Give me exact data.
but he's given you 35 to 40%. His argument is vacuous.
That's not true.
1
It is
minute.
less than 12%.
It
There are
starts from
data
2005.
points. Go study it, sir. There are less than 12% which are charged.
What are you quoting? 1 minute. 1 minute. Rajat, what data are you quoting? 1 minute. Since you
I just simply Googled it.
you've simply Googled it. You are talking to
Please
someone who's
Google,
part
please
of
do
IMA. 1
research.
minute. Everyone has to keep calm. We have to calm down. First, let's lower the temperature. Let's try and understand what we're talking about. So, Rajat, you have Googled something on your device just now, and you are claiming that 12% of beds in private Indian healthcare,
All private Indian. Yes.
Indian private healthcare are above 5,000 rupees. The rest is below 5,000 rupees. Is that your claim?
Yes, that's
What
my
is
claim.
this data source, Rajat?
I'll just pass it on. I'll tweet it
No,
for your audience.
no. Say it. No,
Yes.
we're waiting. Say it. Since you've Googled it, please tell me
no,
the
so
source.
you can also Google it. Meanwhile, let's
Sir,
save everybody.
I come well researched to my shows. I don't Google it. I come well researched.
Where
1
is that
minute.
data point?
Let's
Tell
talk
me
Indian
who's
Medical
authentic.
Association,
So you're
who's
saying
sitting
that
over here.
40% of your
Mr.
bed,
Jayalal was the
the
past
paying
president.
capacity
1
is so
minute.
huge that
Now,
you're
Rajat, you've had your say.
40%.
Now you'll have to listen. Mr. Jayalal is the past president. I think he's a first-hand source. In journalism, we look at first-hand sources. As a member of the IMA, sir, what is your response? And that's a valid question Rajat has asked. How many beds are 5,000 rupees and above?
See, this today, as on date, our data shows 35 to 40% of the beds are 5,000 and above today. But tomorrow, it is going to be 60% because the cost of the beds and cost of the maintenance is rising like anything in our country. And everything, the price index, if you are adding, 2022, what the bed was, if there is 4,000, it is going to become a 4,500 and 5,000 in 2024. And we are not talking for the one-day event. It is going to be a continuous event you are going to make.
Okay.
You are going to talk
I want to
about
add one more dimension to it. This line of argument seems to suggest that if you can afford 5,000 rupees, you deserve to be taxed. That's the line of argument. You deserve to be taxed. Now, Dr. Salunke, you spoke about this briefly before, but I want to put it into context for our viewers. That is it always that rich people take beds which are 5,000 rupees and above?
No, no, please try and understand that, this is a misconception that only rich and super rich will go to the beds which are, being charged 5,000 above. Under the peculiar situations where beds are not available and the type of quality of service that is not available in the public sector, the middle class and lower middle class or higher middle class people have per force to go to the private hospital where the bed charges may be more than 5,000 rupees. As a matter of fact, because you go to Mumbai, see Mumbai quality of healthcare from the municipal corporation hospitals is definitely much better than many other states that I can vouch. At the same time, the availability of such beds to a middle class and higher middle class is quite limited, and they are not in position to, they have their own expectations, and then they seek the type of services from the private hospital.
Okay, my point is, even if you can afford it, why should you be taxed if you're sick?
Why should you?
Healthcare is supposed to be a basic service. Okay, so
just a point I need to add. The room rent is not because of what kind of patient, whether rich or poor. It depends upon the disease also. A patient who comes in an advanced surgery, or a patient who comes in a chemotherapy drug where we are giving drugs, where the infection has to be totally protected. So he needs to be given a room which all the facility where the infections are not going to come. And if there is a patient come in the immunosuppressed patient, he cannot be put in a common room and a 2,000 rupees room. He needs to be provided a place where he is not getting any iatrogenic infection. So he has to be put in the room where it is going to charge more. It is a facility is provided not at his wish. It is mandatorily required for his healing, mandatorily required for his health to overcome. So at that kind of situation, a patient who is sick, putting him at tax is totally unhuman to think of that.
yeah, immunocompromised patients who have special needs will perhaps need the kind of facilities which will cost more. Rajat, you want to come in?
See, well, my limited point is absolving the entire medical industry as if they have not been profiteering, and you question the government whose principal job is not to pocket all of that money. It is to effectively redistribute it in a targeted manner. All you need to do is to build up the public sector healthcare. What private sector has done, the amount of fees that were charged to a common patient during the time of COVID, when they could actually profiteer, they went on a rampage to profiteer. Which self-administered organization came in and controlled the kind of pricing that was being incurred by these hospitals?
Rajat, I have to say you have a fair point.
No,
1 minute. One minute. You have a fair point, but that is not what we're talking about today, unfortunately. Rajat, you have a fair point. And time and again, we have pulled up the private health system. We've held these doctors and these hospitals to task. But that is not the point today. That is not the point today. The question today is whether your government should tax the sick. Whether the GST Council of Ministers should have decided to tax the sick. That is what we're questioning today. That is the question today. You've taxed the sick. You've taxed the patient. If you want to clamp down on corrupt practices in the medical industry, that's a whole different ballgame. That's a whole different debate.
I'm just looking at the
Do you think that the sick should be taxed, Rajat? Yes or no?
I am saying that if a person can afford 50,000 rupees room, must be taxed.
Rajat, should the sick be taxed?
Yes. A person who's paying 50,000 rupees for a night must be taxed.
Sir, it's 5,000 rupees. You added that extra zero. To bolster a very weak argument, I may add. It's 5,000 rupees. You added that extra zero. I will have to end it here. I'll have to end it here. But thank you, Rajat Sethi, Dr. Jayalal, Dr. Subhash. Thank you so much for joining us. It's an important subject. It's an important subject because if the state cannot provide health care, then they definitely should not penalize citizens